So we started with what are domestic skills? Managing finances, managing the home, really huge topics in themselves, or the things that we have to do to keep our home ticking over, not only financially, but upkeep. I've even put pets in there, but I would, they're all part of the home environment. I'd put them in there.
Oh yeah, oh, don't even get started on dogs. Bouncy dogs. Bouncy dogs and people with wobbling all over the shop. Yeah, okay. But again, so important, such an important part of well-being for people as well, especially when living alone. But again, if worked with sensitively, you can work it through.
Meal planning and preparation, that's something I think of straight away. Shopping, housework, laundry. So that's what came to our minds. And when we wrote the clinical tips, they're the examples that we had in mind, and therefore the suggestions that we come up with are based around those. So we're just going to touch on, I know we do this every fortnight, but why do skills become more difficult? And Alex has talked a lot about the cognitive changes, and that's when Alex, you talk about your executive skills, so the ability to plan and organize, and the decision making as well. And when you hear Alex speak, they're the skills that often they're the areas that are becoming more difficult with HD. Maybe before we've truly realized the effects of HD, things are starting to become a bit more unorganized for a person, but you'll be seeing those cognitive changes before the physical changes. I mean, I'm really touching on where you're working, Alex, but certainly the time a patient comes to me with the mid to late stage HD, cognition is really quite deteriorated by that point, and the person's coming probably because of their behavior more than cognition.
Yeah, again, all kind of interconnected. I'm just thinking, about, I think I touched on, again, our man who worked behind the counter in a butcher's. Okay, so in the community, I think what was happening was he was falling over, but again, we couldn't do anything about it because he lived in his own private accommodation. So we explored everything that we could possibly do. And basically it became a community project to keep an eye out on him. So everyone in his block of flats would just they'd phone in and go, he's fallen over, we'd get somebody out, we'd check him over. But then what started to happen was he started to self-neglect. And then what started to happen was he started to spend oodles of money in his local pub. So then he was coming home from the pub and he'd had a few too many jars, he was falling over, he was starting to self-neglect, but everyone in the community, again, kept an eye on him. And then what happened thereafter was actually the self-neglect got so much that we thought, whoa, hold on one second, this is really undignified for this gentleman. And actually it was at the point where it was spreading outside of his flat and influencing all of the good people that were kind of looking after him. So it was almost impossible at that point. But it's about, sometimes it really kind of, in a community, I find myself having to hold my breath an awful lot. And I don't mean in terms of self-neglect, by the way. I mean in terms of anxiety, hold on one second, but what else are we going to do here? And actually, is going into care, whilst it may reduce all of the risks, is this what this gentleman wanted? So it's kind of like all of those things that we have to think through that comes in this whole slide right here.
I'm thinking about a lady that I work with. She is really, I've forgotten the word. Her presentation of her bedroom environment is really important to her. She wants to keep it tidy. She likes to move the furniture around as well. But her awareness of risks in that bedroom environment in a care home setting are quite poor. And we sit down and we talk about some of the poor decisions she makes, such as pulling the bed out, which means she's got a lead training across the room, which means she's more likely to fall, or she's moving items which are blocking the door out into the garden. And she says, yes, I understand, moves them, and the next day they're all back again. So she's not making good decisions, but she's really interested in her environment. And it's not easy for her to be moving these items. It's taking a lot of effort. So we don't want to take that away from her, but actually she is at risk of falling and she's making it heightened. So what we've realized to do is, she doesn't really want our help, but if we go in at the right time of day, and we've worked out that when she's had her morning shower, 10ish, when she's just got dressed, that's the point that she would then want to make her bed, which has become harder. So that's where we go in with sheets, and oh, we're here, can I help? And we're just there in the background, and that way we're not taking the skills away from her, but we're just trying to maintain them and keep her safe. So it's just recognizing what's become more difficult and finding a way in. So we're not taking that skill away from her, but we're keeping her safe in that environment, which leads us nicely onto the importance of maintaining skills. And I think you've touched earlier, haven't you, Alex, about, is that skill still of interest to someone or not? And that is
people,
really,
yeah, I've had people whose you know, their loved ones have gone, but they used to love curry, and I'm like, but they don't like curry anymore. You know, I'm sorry, I'm just thinking about a very simple conversation, that people's tastes change. That's really hard, because actually companions are also need to be considered right here, because actually the person, I mean, I think I've said this before, this ambiguous loss, this person that you're living with is physically present, but maybe psychologically different or psychologically absent. But we still have to consider that in our formulation.
And certainly for me, if I'm someone's coming to me that I've not worked with before, and they got dysarthria, so difficult in speaking, difficult for us to understand because they can't formalize the words anymore. For us to know that person and what was important to them, we really do rely on friends and families to give us that insight about what was important, you know, what was the sense of purpose for that person, what was meaningful to them, so we can help put activities in place. So that's also really important to us to consider.
I think the earlier we get involved as well, the more information like that, the baseline, what we call the baseline of that individual, is really, really important to us, because we can also have combos at that point about advanced planning, so that, you know, later on we kind of know what we're aiming for, sort of in line with that person's wishes and values, and ultimately enables them to be more in the driving seat if possible.